Taz approves. So it is a Saturday, I got the day off. I'm now on ophthalmology. Much more relaxed rotation than what I was doing last month in November. So got my smoothie here. My friend's about to pick me up in a few minutes. We're gonna go hiking. Gotta stay active, gotta take care of yourself on the weekends. Hey doggy. What would you do if money was not an object? You didn't have to worry about that. You didn't have to worry about your job. You just could do whatever you wanted.
Well, I'd travel, the main thing, but I think I would just stay in school. Just like go to NYU or something and take cool literature classes and anthropology and just keep learning. And then travel.
And also that college lifestyle, right?
Yeah, something like that. What about you, man? What would you do if money wasn't a thing?
I respect the literature thing. I'm not as much into those sort of arts, I guess. I'm more into making videos and racing cars. Well, here was my ideal lifestyle. I would become a plastic surgeon and start like a biomedical business and sell it. And then money wouldn't be an issue. I would just travel the world, do volunteer surgeries, cleft lip, cleft palate, burns, whatever, reconstructions. Spend 1 week on vacation in the place and then 1 week just operating and then like go to the next place, you know? That would be my ideal lifestyle. So Connor's Subaru started smoking. The temperature gauge says everything's fine, but
we're here.
Let's hope we can get back home, I guess.
Oh, we can just coast home. It's fine.
I love dogs.
You see, you got plastics and derm, and we take this stuff way too seriously. I guess it's not way too seriously. It's the right amount of seriously.
Yeah.
Wear your sunscreen, kids. Don't get skin cancer. So I just got one of these Fitbits. Let's see if this is going to record our hike as a workout.
Sorry.
Conor's an orthopedic surgery intern. He's in his first year of ortho.
And we're both outside of the hospital right now.
I know, look at that, isn't that promising? So Conor, what made you decide on orthopedic surgery versus plastics, which, you know, is also pretty cool.
I always wanted to do surgery. What could be cooler than getting paid to cut somebody open and...
I mean, if we just pause it right there and say, now you just sound like a psychopath.
Yeah, I probably should edit that one out. So I like fixing things. I like working with my hands, solving problems by putting things back together. And it's fun when there's like broken bones and stuff not where it should be, and you get paid to do that.
What is it about orthopedic surgery over other kinds of surgery that drew you towards that?
I think orthopedics is the most hands-on. You got drills, you have saws, hammers.
Did you always know you wanted to do ortho?
No, actually, well, I knew I really liked ortho, but it's really competitive to get into. But I think I could have been happy with almost any type of surgery. I was thinking actually gen surge for a while. But I think I always thought ortho was cooler because we're just really like power tools and big, open, bloody procedures, not to sound like a psychopath or anything, but I've always really wanted to do like overseas humanitarian work. Went on a mission trip in med school. I went to Haiti, one of the pediatric orthopedic surgeons here. And it was just amazing the things he was doing for people that would otherwise have like no chance of a normal life. Like not only doing something I love, but doing it to help people and making money too. Like while doing that, I can't think of a better thing to do.
If that's not love, I don't know what is. Hiking was a great success. It's about an hour and a half round trip. Didn't go all the way to the top. That would have been a full day hike.
There's perfect weather.
Yeah. It makes you like, it made me at least feel really grateful to say, hey, I'm healthy enough that I can do this, you know? So is it true that there's a certain level of bro required to be an orthopedic surgeon? Because I wouldn't say that I'm a bro. It's not like I own a beer pong table or, you know, or listen to dubstep when I go to the gym. Yeah, I'm just mostly kidding about the whole bro thing, but how important is personality fit when it comes to choosing a specialty?
So if there's a certain qualification for bro status, I probably wouldn't have made it in.
You gotta bench your step one score.
I think the main thing for something surgical is like you have to have a certain level of confidence for sure, because like you're walking into patients like rooms or the ED, and you know, like they're hurting, they're crying, and you know, you have to like hurt them more. You know, you have to like put their bone back in place or put a traction pin in or something like that, and you have to like know what you're doing. And especially when you're starting out, you don't all the time. You might not always know what you're doing, but you have to act like you know what you're doing.
Fake it till you make it. But always within reason, because you never want to do anything that you're actually unsure of, where it puts the patient at harm.
Well, that's the thing about residency. You always have somebody over you. There's a chain of command. You always have someone, you know, watching you and telling you what to do. But still, I mean, there's a certain level of you have to be confident in what you're doing. And as far as that, personality is huge, you know.
One of the things that struck me while hiking with Conor, we're having some great conversation, he mentioned all these great experiences he had in the operating room, and he even prefaced them by saying it wasn't about the procedure he was doing. He was doing some, you know, less desirable cases like decubitus ulcer repair, which is usually pretty smelly, it's not the most fun procedure, let's just say that. And what he mentioned though is it's the people that you work with. Less about what you're doing and more about who you're doing it with. Conor, where are we at?
We are in downtown Redlands.
Well, what are we doing here?
Ice cream.
Ice cream. What's going on here?
Redlands Christmas Parade.
What parade?
The Redlands Christmas Parade.
Redlands Christmas Parade. Very cool. Have a great day.
Thank you.
So I personally did not get crepes or ice cream. If you guys are looking for a foodie channel, it's not it. But, Conor, why don't you tell us, how's the ice cream?
It's pretty good. All Minute is kind of well known around Redlands for making some pretty tasty ice cream. They make it right there in front of you.
Oh, really?
Liquid nitrogen, yeah.
Super cool. Had a great time hiking with some new friends. One thing I want you guys to remember is that as a physician, you can't take care of other people unless you first take care of yourself, and that means both mental and physical well-being. So exercise, stay active, that stuff is very important to you. Not just working all the time, but having a good, healthy, balanced life. It's gonna help you go a lot further than if you just work. So, as with anything in life, it's always about balance. I hope you guys found that video useful. If you liked the video, make sure you press that like button. Hit subscribe if you have not already, and I will see you guys in the next one.